biomarkers are primarily used to monitor the effectiveness of any anti-cancer drug, either by curing or remission, depending on the number of cancer cells remaining in the body. They are also used during screening to identify individuals who are at risk of developing cancer, provided that certain conditions are taken into consideration, such as chronic liver disease, goiter, or diabetes. This simple clarification on the clinical application of the tumor markers for screening or monitoring form the basis of understanding the current breakthrough in the treatment of cancer. Following the modality developed by Stanford Healthcare in the US, only the patients who are clinically diagnosed with cancer will have their results shared at the moment. Currently, an 80-year-old man who was diagnosed with prostate cancer, had radical prostatectomy, was placed on a bottle size of 124.2 cl for a therapeutic cycle of only 23 days. We succeeded in normalizing the abnormal level of PSA in the body to 0.67 within 2 weeks of commencing the treatment. Secondly, a 36-year-old woman who was diagnosed with breast cancer received complete cycles of chemotherapy, followed by mastectomy or radiotherapy. She was placed on a bottle size of 117.3 cl for a therapeutic cycle of only 23 days. We succeeded in normalizing the abnormal level of CA125 in the body to 0.05 within 3 weeks of commencing the treatment. Thirdly, a 41-year-old man who was diagnosed with soft tissue lymphoma was placed on a bottle size of 110.4 cl for a therapeutic cycle of only 23 days. We succeeded in normalizing the abnormal level of CEA in the body to 0.84 within 2 weeks of commencing the treatment. On the contrary, a 60-year-old man who was diagnosed with throat cancer had laryngectomy didn't show any significant improvement despite being on the remedy for over 6 weeks as a result of uncontrolled diabetes, anemia, and malaria. We are currently monitoring the effectiveness of the remedy among the patients with BPH and hepatitis using PSA and viral load tests respectively. We thank you very much for giving our speech and attentive audience. May Allah bless all of you.